Hello, my name is Cassandra Bride, and I'm the best dental hygienist in the world. And I wanted to take a moment or a little bit of time to come on to discuss dentistry and let you know that I've been in the dental field for 13 plus years, and I consider myself to be the best dental hygienist in the world. Having worked with all socioeconomic classes, having worked in over 150 different dental offices, and working with hundreds of staff who were evil to some of the best in the business. So I've worked with the best and the worst in the business, which is why I'm educating you as patients on what to look for your own health, to let you know the importance of your dental care, and let you know that it's actually more important to see your dentist than it is to see your primary care physician. And a good dental hygienist will be able to take a look at your medicines, take a look at your gum tissue and other areas of your life, and note whether you are on you're getting the proper care, honestly. There's been many times in my career where I have looked at my patient's gum tissue and asked them, are your medicines correct? Because they would literally bleed profusely, or their gums would be overgrown, or different areas like that, because as a primary care physician, they're not familiar with the mouth, nor do they take a look either. The dentist doesn't stay in the room but less than a minute, and the dental hygienist spends at least 20 to 30 minutes exploring and looking through all of your oral cavity. There's bacteria that is introduced into the body by eating food and drinking water. That's how bacteria gets in the body. It's through touching things and then putting things in your mouth. And then it starts setting up shop underneath the gum tissue or around the teeth. They often say that a dog's mouth is cleaner than a human's because we have bacteria that's different than a dog's. I'm intelligent in pharmacology, nutrition, and dentistry, having taken multiple classes to educate myself, not to mention my own personal experience through working with pharmacology and knowing the abilities to take yourself off medicines if you do the proper care, meaning you don't have to turn 50 years old and automatically take a blood pressure medicine, which then creates side effects. However, some people will spend their life working as a pharmacist and not knowing anything about pharmacology. The first thing that happens when you come into your dental office is you're going to get a full mouth set of x-rays, period. Unless you have a good set of x-rays from another office, which likely is not the case in most occasions, and most offices, unless you're going to a corporate office, does not upgrade your full mouth set of x-rays. It's interesting to see my career expansion as in thinking I didn't need to take an x-ray, a full mouth set of x-rays, and when I did take a full mouth x-ray, I saved one of my patients because their implant was improperly placed or improperly evolved. However, every time I request certain aspects, you as patients argue about it, which really creates a drama-filled day for me. Saying that your x-rays you have had CAT scans, etc., etc. However, an x-ray is like a dental x-ray has evolved to, it's like standing in front of a microwave. By thinking about the thinness of this tissue and this bone, that's how little radiation is necessary to look into your jawbone to see how the bone support is around the teeth, so I can gauge what kind of cleaning you will need. That's the first step in deciding what kind of cleaning you'll need. Meaning I can literally look at an x-ray in like 2 seconds and say, this is a deep cleaning. I ain't cleaning that off for free. That's going to take me at least an hour to clean that off. I only have 10 to 15 minutes, which is how long a normal cleaning should take. Anything longer than that, you're a periodontal maintenance. Once I've completed the full mouth set of x-rays, I've asked about your medical history. I've had a small talk conversation. I'm literally Googling over your physique, your conversation, meaning I'm asking questions about your lifestyle. I then chart the teeth to see what existing restorations you have. I note if it's an amalgam, which is a silver filling, whether you have a crown, whether you have a bridge, etc. Meaning I'm taking out teeth that are on your chart so I can create a treatment, a full life, a lifestyle treatment plan for you. It's a lifestyle. Meaning I might say you need 25 crowns. However, I don't want you to get overwhelmed. This is your lifetime goal. This is our goal for your life. Meaning I, in the long run, want you to keep your teeth until the day you die, if you die. I then go around and probe all of your teeth. 323, 323, 333, 443, 434, 434. 2 2 2 2 2 2 2 2 2 2 2 2 2 3 2 3 2 4 4 3 3 3 3 3 3 3 3 3 3 3 3 3 3 3 2 3 3 3 3 2 3 2 3 3 3. That's a healthy mouth. 6 5 6 4 6 6 5. That's bad. 4 4 4 4 4 4 4 4 4 4 4 4 4 4 4 2 2 2 3 3 3 3 4 4 4 3 4 4 4 is mildly bad. You're likely, if you're at 4s, is you're in a crossroads. It's basically the tooth. This is what we're measuring. Your tooth, gum tissue, and then there's a space between the two that bacteria live. I put a probe there and I measure to see how far the probe goes down to let me know how much pocketing you have, which gives me a gauge of how likely you are turning into periodontal disease, what risk you are for periodontal disease, whether you need a deep cleaning. Another aspect of how I know you need a deep cleaning. Then I'm looking at the amount of buildup, which looks like billowy clouds all stuck to the side of the teeth. If I see that on an x-ray, I know it's bad. I can't even get my probe past it. It's like barnacles on the side of a boat. Why is the barnacles on the side of a boat bad? Is because that's where the calculus likes, or that's where the bacteria loves to live and colonize itself. There's a couple of ways that periodontal disease progresses, and it's first, it can be recession. So periodontal disease is technically recession, which is where the gums leave the teeth, so long in the teeth. And sometimes I feel like I can't, and I know I can do a regular cleaning on someone like that. However, in my intuitive self, I like to tell you it's periodontal disease to remind you that it's bone loss. Because gum tissue, bone moves away and then gum tissue moves away, leaving you with big pockets around the teeth. Okay? So you got the space between the teeth, and then overlapping it, it's the tooth. This is the bone. The gum recedes. The bone recedes. They both recede. Tooth comes out long term. Not only is that an important discussion, but we also have the bacteria that lives in this calculus. Anytime you bleed in the mouth, the bacteria is released through the whole body, causing you to have heart attacks, dementia, arthritis, any irregularities in smooth surfaces, bacteria latches onto, including the gut. So we are preventative care providers, preventing these bacteria from entering into worse stages of life for you. However, you fight us more than you do your physician, who tells you you have all this health problems. You'd rather go see a doctor and for him to tell you that you're sick than to prevent problems, if that makes any sense. You have more coverage on medical than preventative care of dental cleanings. A deep cleaning is not a scary thing if you have the right hygienist. I don't numb everyone either. It's time consuming. It's a pain in the butt to have to do a deep cleaning. And it's worth the $500 to save your life. What else do I want to say about that? Envelope, heart attack. Generally, you could get your whole 4-quad cleaning in one visit, but sometimes you come back for 2 visits. I prefer to do the whole mouth in one cleaning because I get all the bacteria cleaned up. However, there's some lazy hygienists out there, and sometimes your mouth is really bad. So there's 3 stages to a dental cleaning, which is a debridement, which is you have so much calculus that you need 3 parts to this cleaning. The beginner stage is to take the largest chunks off, which is the most fun for me. It's like taking chunks of stuff. It just like flies off in chunks. It's kind of gross, but it's fun. The second one would be the deeper cleaning. Takes the longest. With that, you would need an hour, sometimes longer, because this new calculus that's out there now is atrocious, horrendous, and will kill you. And then the final is a follow-up where you would come back in 6 weeks for another, what's called a periodontal maintenance. And then we'll see you back in 3 months to see how you look. And then at that point, I might send you to a periodontist because I'm only can go and do so much with calculus that is so hard to get off that I'm like, holy crap. I cannot believe what this crap has turned into. Not to mention the equipment that they have me using here. Not to mention my number one importance is the fact that I want you to keep your teeth. I don't really care about your financial situation. From here, you can make your own decision. Because from first periodontal maintenance to second periodontal maintenance to third periodontal maintenance, you could have a heart attack. But that's not my problem. I've already recommended that you go see the periodontist. If you're not doing your home care appropriately, that's on you too. You should be brushing twice a day, flossing every single day, and you should be rinsing with an antimicrobial mouth rinse. Simple. If you eat soda, your gum tissue will likely bleed more because just like you like sugar, the bacteria like sugar, and anytime I have a soda, my gums bleed. It actually makes me feel like this. Because that's what sugar does. It's tangy and it causes vibration. Once we've decided your diagnosis on basic, because oftentimes the insurance company is monitoring what we provide for you, by the way, and you fall for it every single time. Meaning I've worked at offices where I know this person has terrible periodontal disease and I'm forced into doing regular cleanings based on a patient decision, that doesn't sit well with me, that's for damn sure, to what the insurance company is telling them. However, they don't even know how to send off the proper documentation to get it coverage for something the patient pays for. Your insurance company should allot for you deep cleanings 100% paid. However, they don't. And you don't say nothing about it. Once I've established your periodontal condition, which is based on visualization, medical history, meaning if you have diabetes, if you have high blood pressure, you have bloody gums, you're a lot more likely to get a deep cleaning. Because you will have a heart attack. You just may not die from it. You may not even know you had a heart attack. Depends on the bacteria. Then we also decide on periodontal conditions based on calculus levels, bone level, plaque levels, and sometimes it's not as straightforward as it sounds. Meaning sometimes you can get away with a debridement, but you're still on the fence about whether they need a deep cleaning. So sometimes what I'll do is I'll say, well, you know what? I'm going to give you a chance. We're going to try debridement first, and then we're going to see you in 3 months, and then I'm going to see how you look, but you still might be a deep cleaning. I just can't really gauge it right now. I feel a little on the fence. Your health is my number one priority, though. There's something that's stopping me from doing a deep cleaning. And it's not a patient, and it's not the insurance company. It's God, really, because he loves to play the game. He loves dentistry, by the way. It's an art, and it really is an art. It's a puzzle piece. It's puzzling things together. So once I've had the discussion with you about your periodontal condition and home care, which is really simple, you all know what to do. However, we have a psycho dentist standing over us acting as if you're children. It pisses me off every time they come in the room. Well, Cassandra will show you how to floss. Okay, get the hell out of here. This is a 42-year-old person. They should know how to floss. I will literally tell them while I'm in their mouth, you're missing here, and I will take my finger. You're missing here, you're missing here, you're missing here, you're missing here. Here. Your tongue is filthy. And then he's going to come in and say, did you teach them to floss? You get that I'm dealing with the biggest ego on the planet called a dentist. Then we call the dentist in, which hopefully doesn't take an hour, which has happened to me before. However, my patient and myself had a really great conversation. But that's not the point. Again, I want you to be aware of what we're dealing with ego, meaning they don't really give a shit about you as patients. That's new age dentistry. Meaning we become the burden, which is a dental hygienist, to come get them for a two-minute exam when they should have gone the rounds when they took their last check. But they're too good for that. They want to make sure that you've cleaned up everything and look like the hero. Then, as I've already shown you in photos, I usually take photos to show you silver filling amalgams. Amalgams actually send a vibration in the body that cause migraines and other medical conditions. cracks in the teeth that could cause fractures and breaks. So anyone who has an amalgam filling, I'm already telling you that we are going to change that. I'm saving your life by changing your silver into composite. Based on the size is based on whether you get a crown. Most hygienists won't tell you why you need a crown. They don't even know why you need a crown. That's how stupid they are. I'll tell you why. Here's the tooth. If we put a filling that's this big, that is going to break. Your tooth, you might as well not even have a tooth. You're wasting your money. That's essentially a crown. And the dentist spends an hour to 2 hours working on a filling that costs $150. So he's dumb. You think that's compassionate. However, I'm going to let you know that it's dumb because you just lost a tooth. So it's double dumb. Let's say this is the top of the tooth. This is your amalgam, and you've got fracture lines up the wazoo. This amalgam literally watches it when I'm watching it while I'm cleaning with my ultrasonic. The metal, the brown metal is bleeding into your body. Why? I wonder why I have joint pain and blah, 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 blah. Now, the old days, this was normal. We were supposed to put these in the mouth, and if they're sealed, they're not terrible. However, this is not a sealed filling any longer, meaning when you are brushing, flossing, eating, sitting, you may have a metal taste in your mouth, and it's because your amalgam is leaking through your blood system. And all it means is it's time for you to have a crown. Congrats. So my conversation looks a little like this. I want to let you know you have a lot of silver fillings in your mouth. They are breaking. Let me show you. Let's look again at the broken filling. This is the top of the tooth. Broken, broken, broken. You could literally, as they see and this filling goes all the way to the sides. If you bite right here at the right time with the right thing, this whole cusp is gone, leaving you with a hole of a tooth. However, right now we're able to just put a crown on it, and we don't do root canals anymore because root canals put formaldehyde in your body. So if you need a root canal, you should have an implant. That's what God said. Just saying. That's why we invented implants. Where was I? Where was I? So what I do then is I look at all the teeth in the mouth. I get a whole big picture of what you have, what you need. I tell you what a crown is. I tell you what a filling is. I tell you why for each. The dentist comes in. Some of them will ask my opinion. I say, da 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 da. He needs a lot of crowns, needs other fillings. So he's prepared before he looks in there that he's going to have a quick conversation around home care. Takes him less than a minute. He says 2 crown, 3 crown, 4 crown, 6 crown, 9 crown, 10 crown, and this is real stories. 13 crown, 14 crown, 17 crown, 18 crown, like 17. 1, 16, 17, and 32 wisdom teeth. Go. Bye-bye. Very rare cases. Is there enough room in the mouth for you to have wisdom teeth? We must have had big mouths or something back in the day or something. Then we come up with a puzzle plan because it sounds all fine and dandy until you have somebody who has number 17 that now looks like number 18. Or number 17 is there, but number 18 is not there, and number 19 is there. And so now we discuss if we want to put an implant Or if we want to use 17 to 19 as a bridge. Because 18 has a lot of bone loss. Money is an issue because we always take everything into consideration as well, let's see what the best option for the patient is, but let's see what the best option for health is too. And then let's give them all the options and then you make your choice. Any child should go to a pediatric dentist. However, after working at a pediatric dentist, you know what? You get better service with me. For cleanings, need sedation? There you go. Yeah, and pediatric dentists are insane. They have no people skills or personality to let kids be kids. And they don't know how to discipline the kids. And they don't really know what they're doing. It's what my take on pediatric dentists are. However, the idea around pediatric dentistry is pretty good. Like, they don't even ask them how school's going. I'm not even gonna get started on that. But I will tell you, as parents, your children have more cavities than I've ever seen in my lifetime. They're the most unhappy children on the planet, and it's all of them. Yet you still don't care. Black Lives Matter. And I want to give a shout out to my kids and tell you that I miss you and I think about you often. And then I also want to let my patients know what I deal with as a provider for you as I'm dealing with their interpersonal bullshit. As I'm attempting to assist you in your healthcare, they're attempting to assist themselves of disempowering me within the practices. I'm better than you, says Hope, who works at Surfside Kids. I'm the manager. Here's a list of things that I need you to fix while I sit on my lazy ass and do nothing. I'm the manager. The other one doesn't even hang out with the children while they're waiting on the doctor. She goes and sits on her phone in some other room. However, taking TikTok videos is not allowed, or having fun at the practice either, because you will get drug tested. Just to let everybody know. I've never worked at such an insane office in my life since COVID happened. The best office in the last 4 years I've worked at was a Heartland office located in Virginia Beach that I had to leave due to this constraint against me, and they all held it against me. And yes, if I would have stayed, we would have had a fabulous time. It was really finally starting to look up. So letting you know, as a patient, what I'm dealing with is an office manager who thinks they're in charge, but they're all focused on money. And then I'm dealing with a dentist who is working for a corporation, who is battling the manager, but basically using the manager as a slave, as noted by the Howard Family Dental location across from Walmart in Brunswick, who uses Hala as her stomping ground. Her name is Dr. Jacob. Meanwhile, we have two dentists, one of which is amazing, which is my dentist, Dr. Billis. Could have been a fabulous practice, and if I ever find him in another location, I literally would show up in a heartbeat to work with him. Screw Dr. Jacob. She is a horror. So me and Dr. Billis, our fabulous team, going to town and assisting Black Lives Matter. as they're attempting to abuse me in the chair, while my assistant sits on her phone and shops, while I'm making $35,000 to $40,000 per month. All of which I taught her everything she knows. However, Black Lives Matter has instructed her not to assist us. So me and Dr. Billis talk shit about her behind her back. But she doesn't care. She pretends to be my friend. We go to lunch every day. We laugh and joke and da-da-da-da-da. However, she has no drive to succeed. Then we have Dr. Jacob's staff, who she's created into a demonic way of being. Courtney Highsmith is one of those people whose Black Lives Matter, who they paid to infiltrate the system of me and Dr. Billis, who used to be a friend of mine, by the way. Until I got too skinny and she got jealous. Then she got greedy and psychotic. Then we've got all these BLMs coming in who need a shit ton of work, y'all. It was disgusting. They're spending their money on going to trips to Jamaica as I'm cleaning their nasty teeth. While we've got Carrie coming on board, who used to work at the office, who is attempting to talk shit about Dr. Billis's work. So Dr. Billis is a seasoned practitioner, fabulous practitioner. Fabulous, fabulous, fabulous. We've got Carrie, who's a decent worker. However, she's got troubles here and there. However, Black Lives Matter is putting in her head that Billis doesn't do good work, which then bleeds onto you as real providing patient caregivers. You as a patient no longer do your home care because you have a shitty hygienist that took my spot who doesn't give a crap about your teeth. So you don't have anyone looking out for you in, you better do your job in a loving, fun manner. The new age of dental is you lose all your teeth, which is where we advanced you into you save your teeth until you die, to reverting back with Black Lives Matter in charge to now you're all in dentures. While Queen Jacob runs around flipping her hair all over and making you wait at least 10 minutes for a check and then walking in and being rude to the patients. While she creates a horror show for us on the other team. Women in dentistry. Not the first one I've had to deal with either. Not the worst, but the worst. But I produce so much money! As she steals one of the girls in the office's boyfriend, and then pats her on the back and says, I'm so sorry that happened to you. And guess what? She's from India. Born into money. And her work is not that good, by the way. It's decent. What does that do to you as a patient? All this drama that's going on, y'all. Because it's like, okay, fine, yeah, we all got problems at work. However, these people are not in workable spaces. They are not in a workable space at all. I walked in every morning, was super duper friendly. And they were nothing but psychotic as they all claimed, I voted for Trump. No, you didn't. You didn't vote for the person because you don't act as if you care about people. But they all wanted the money that came along from free shit. Because they're all trailer park trash, by the way. Like Larkin. Trailer park trash. How many kids do you have and how many different dads? The only decent girls that were at the front who welcomed you into the office. However, they were berated constantly by Dr. Jacob, as in her schedule was never right. It never is right. You deal with it. So you come into the office and you meet Summer And you meet the lovely lady to her left, who I can't remember her beautiful name, but I loved her. She was so fabulous. Awesome halo at the front. We're so lucky to have you. They ran this one off. Said it was for money, but it wasn't for money. Literally had your miscarriage because of the psychosis in the office, by the way. You then walk in already fearful. You meet me, you create fearless. Little fearless fairy showing up. Hey, fearless fairy, you're doing such a great job. However, you're not supposed to be on the internet. So we create a rapport, me and my patient. However, I know how to battle the energy. Meaning I've created this beautiful treatment plan for you that will list your whole lifestyle. It's like super easy. All you have to do is look for the things that need to be repaired. Because it's necessary for everybody this time. However, the energy of the space creates a demonic feeling where the fear is still present. As I left the business, the fear explodes to the capacity of beyond imagination. Meaning, again, because of Dr. Jacob, because of this community known as Black Lives Matter, we now recreate what the generation before me combated, which is fear attached to the dentist. And now fear attached to the dentist now returns, which is everything that the BLM wants for us, to live in a fear-based society, as you all say, not true. Enough is enough. Yes, you need crown. Okay, I'm going to get 2 crowns. I'm never coming back. Don't get me started when the wife works in the business. I'm so friendly and I love you. Let's hire you. Okay, well, I'm ready to start working over here. I never heard from you. I asked you to go to coffee. You said you'd call me back. You never called me back. My husband's on the board, and look at how beautiful this office is. And I was just at this meeting at this place, and I have no idea about dentistry. And now I've hired a brainwashed millennial to lead people while I hire only millennials who literally clean teeth where they leave calculus everywhere. New dentistry. That's what you're in for, folks. That's what you're in for now, folks. That's why it's important for you to hear me, because not only are you being affected by emotions, which I've discussed with you in leadership form, but in your health. But that's so not true. Okay, cool. Because you know what? I really could give 2 shits less about going back into dentistry. Probably one of the best careers and the worst careers I've ever freaking had. Some of the most toxic individuals. Literally a patient who is a psycho, who grits and clenches her teeth, who you couldn't even touch her gums like this without her jumping. Because she clenched her teeth so hard because that's how angry she was inside. Dr. Olson, I don't like the way she did that. Dr. Olson says to me. I said, okay, I'm so sorry that you had that experience with me today. I would love for you to give me a second chance. And walked out of the room, and I never saw her again. Thank God. The best dental hygienist in the world. Well, that's not true. Yeah, that's what the siren psychopath says. Is there anything else as I go and eat my sandwich from Larry's Giant Subs? I'm hoping that you didn't put any spit or psycho nonsense into my food. Since that's something you enjoy. as I attempt to educate people on health and wellness to assist them in their evolution in society. However, nothing's good enough for you. But you keep attending those little galas that you love to go to, wearing your suit. Wearing your suit and taking your photos when there's real work that needs to be done. Instead of all of you, and I'm not just talking about Gary, I'm talking about all of you, like The Rock, Steve Harvey, Shaq. Oh, look how cool you are. So what do you say? You do these things like in little snippets, but what do you do the rest of the year? You just sit around and do nothing? You don't have a job or anything? So you're like a menace to society? Is that what you're saying? You just lay on the couch all day long and make jokes? And then go on TV on occasion to fill your busy schedule with fun stuff while the rest of us work our asses off and struggle as you promote Black Lives Matter. And that's our leadership team, known as Celebrity, Entrepreneur, and don't get me started on the trophy girlfriend that stands on his side looking all sexy in a balloon outfit. Talk about the ugliest dress I've ever seen. Doesn't have fashion sense, doesn't have an education, doesn't have anything. And that goes for all of them.